Hello, everyone. What's up? My name is Ryan Andringa, and this is my podcast. Today, we're going to talk about what are these things. They're called the 340B drugs. There's multiple programs across the nation. What are they? So let's dive right into it. I got a nice slide here coming up how the 340B program works. So you go to the hospital. You're either an injured patient, you're going to a visit. You go there, your insurance will cover some of your medications, and this is specifically talking about medications. So cover some, others are not covered. So then you can see here, 340B allows the hospital to save a portion by offering these drugs to the hospital at a discounted rate. So where do those savings go? The hospital then uses the savings to provide free services to low-income patients, multiple examples, and other places that this money goes. And then that in turn trickles down to us, the consumer, and people that live in those communities. So the 340B program, it is a public health service act that requires pharmaceutical manufacturers that participate in Medicaid to sell these drugs at a discounted rate to healthcare organizations. These organizations then can use these savings and apply them to the uninsured or low-income populations that they serve in their communities. And then that allows the hospitals to stretch their federally based resources and expand their services across their communities. So one example, passing them on to low-income patients and providing free services, but also a few others. They do offer free vaccines, services in mental health clinics, implement medication management, and community health programs. So what I'm trying to make people aware of is that there's actually been some new legislation in the works that exempts hospitals from receiving this original reimbursement, and this has been seen through COVID, especially now on the tail end of COVID, and we're outside of the national pandemic. So it's difficult because instead of the hospitals getting this money, this extra savings, there are restrictions being put in place by the Centers of Medicare and Medicaid Services that limit hospitals to only receive a fraction of the original reimbursement. So the new legislation of the Centers of Medicare and Medicaid Services, they want to save the money and reallocate the money to themselves. So put it back into the Medicare and Medicaid services, but the hospitals want their reimbursement so they can pass the savings on to their community. So that's kind of the big debate there. Now, I am a nurse. I work at Unity Point Health in Sioux City, and I attend Morningside University and participate in their nurse practitioner program. So we can see here, Unity Point is where I work, Sioux City, on the far left side of Iowa, far west side. Multiple hospitals of Unity Point participate in this 340B program. And then we can see in 2019, for Unity Point, the 340B drug discount program resulted in significant savings. About $90 million in 340B program savings were found at Unity Point Health. So that's in 2019, $90 million in savings that Unity Point Health they're saving, and they can put that back into their community. So then 237,000 million was in total in uncompensated care, 363 million in total drugs spent without program discounts. So, and then a few other specific areas in Illinois, Unity Point Health, endocrinology, diabetes, and other clinics. Due to this restraint on the 340B program, 836 insulin-resistant patients have been forced to switch the quality and the type of insulin they were receiving, and now they can't due to these restrictions. So that's one situation. Another one we have in Iowa, we're having contract pharmacies in rural communities enable patients to receive these affordable medications. So recent action by manufacturers have reduced over 50%, which is 1.5 million, of 340B savings and directly affects the communities that they serve. So the pharmacies patients go, and they are seeing increased prices in their prescriptions. And then here in Iowa, Fort Dodge, we see that these pharmacies have to overcome these barriers to enable patients to even afford their medication. And then recent action, specifically in Fort Dodge, impacts 40% of the savings. So they're seeing an increase of approximately 40%. And then maintaining compliance at Unity Point. Some hospitals actually lost compliance, but Unity Point did maintain through the pandemic. So we can see here, 2015, $12 billion was spent. This is nationally now in savings. 2021, $43 billion. So this is growing. And this directly impacts reimbursement, especially in small rural hospitals such as Unity Point, St. Luke's. We need to get more hands into these local, small, rural hospitals, not into the government, because we don't know where that's going to go. We want it in our communities. We want to continue to advocate for those struggling in rural America. Thanks.